Hello, my name is Sarah Furness and I'm a Senior Product Developer at NOCN Group, and I'm going to introduce you to our new Level 3 Diploma in Adult Care. Here is an overview of the qualification. The registration start date is the 1st of May this year, and the last date for registrations on the existing qualification is the 30th of April. There will be 58 credits, which is the same number of credits as the existing qualification. However, the overall GLH is greater, 35 hours greater than the existing qualification at 372 hours. What are the differences between the existing and new qualification structures? Well, there's more mandatory credit. There's now 39 credits as opposed to 28 credits before. And the optional credit is less at 11 credits as opposed to 30 credits. This means that you could choose one optional unit from the digital skills units, one optional unit from the leadership and management, and 3 credits from all optional units. So here's the list of mandatory units. I'm not going to read through them all, as they're very similar to the same or similar unit titles as the existing qualification. The difference is in this list that there is a unit on restrictive practice and one on promoting choice and independence for individuals to encourage implementation of best practice. These are the remaining mandatory units. And you will notice that the former large health and safety unit of 45 GLH has been split into 2, general health and safety in care and health and safety topics. There is also more emphasis on promoting the learner's personal well-being in response to the impact of the pandemic on carers. Right, the optional unit groups. Here are the titles of these unit groups: digital skills, specialist units, leadership and management, aspects of support, and clinical skills or healthcare tasks. For the digital skills units, we devised 4 level 1 units to give learners basic digital skills. For example, in how to use devices safely online, how to create and edit documents, how to use digital devices to store and retrieve care information, and digital care planning and record keeping. There are other level 2 and 3 units to provide greater stretch and challenge for learners who want to take things further. For the leadership and management unit, we created short 15 GLH units in change management, conflict resolution, developing and supporting others, and leadership styles to enable learners to study more topic areas. The other difference is that there is now a level 4 unit in adult care inspection to help learners to prepare for one. The specialist units have the titles that you can see on the screen. The clinical skills or healthcare task units are similar to what they were before as well. Aspects of support. The difference here is that we have included a level 4 unit on reablement plans. So as the optional units are updated units to the previous existing units, it is possible for learners to use APL for achievement of previous optional units. The difference between the existing and the new optional units is that the new optional units will have some learning outcomes and assessment criteria removed. And within the appendix of version 2 of the new specification, there will be a mapping showing what content has been taken out of the new units. In the specification, Skills for Care asked AOs awarding organisations to elaborate on assessment requirements. So we were asked to elaborate on the possible job role of an expert witness. They could be a team leader or manager for the setting, or a health practitioner, such as a phlebotomist, consultant, or surgeon. The required number of learner observations should be agreed between the assessor and the learner based on their role and responsibilities. There should, however, be a minimum of 2 observations at the beginning of the learner trying to acquire the skill and at the end where it is judged that they have potentially mastered it. The observation should be long enough to enable evidence to be naturally occurring. In terms of remote technologies, they can only be used by assessors to observe assessment planning and feedback, professional discussion, online team meetings where all participants have agreed to be recorded, planning for supervision, simulated activity if allowed in the unit, and the tutor assessor must use a standardized approach to review which units and criteria might be suitable for a remote assessment and when the candidate will be assessed in this way. In terms of resources for centres, NOCN has provided example assignments for the mandatory and digital units, which are stored on NOCN's new vLearn e-platform, which are available for download now. And potential resource lists have been included in each assignment to assist learners with their research. NOCN's e-portfolio system could be used to store learner evidence as well for the practice portfolio. Key strengths of the qualification identified by Skills for Care are clear and extended instructions about assessment requirements in the qualification specification, good stretch and development for learners who will be working towards this qualification. The mandatory content has comprehensive guidance notes for unit interpretation and application. And the optional content has been developed and structured clearly with good focus on the new areas of digital skills and leadership and management. There is a linked qualification to the new level 3 diploma in adult care, and that is the certificate in phlebotomy, where the optional unit obtain and test capillary blood samples is common to both qualifications. I'd like to thank you for listening to this recording, and if you have any further queries, please use the email address on this slide to contact us. Thank you for listening.